The Duet is very nice. I had an older YAG laser that was sort of on its last legs I'd had for many years and needed to be replaced anyway. And so it was very convenient to get a machine that was both the YAG and the SLT. This machine is also just very convenient in that the table is very versatile. And we see a lot of elderly folks and nursing home patients who are in wheelchairs, and this can go down very low, and we generally don't have trouble with the wheelchair patients. With the old machine that we had, some patients we couldn't get up to the wheelchair, and years ago, before I had my own machine, or in one of the satellite offices also, we used to have one of the services that would bring a laser in, and many times we had problems with the patients in the wheelchairs so we couldn't get them up to the machines. But this machine has worked very well for that. It saves space. My old machine, of course it was an older model, so it was larger. And this is a very compact machine. And so we have one machine instead of having to have two. We do have other lasers. We have an argon in the other room. We have cameras. We have the visual field machine and the HRT. So we have a lot of equipment around, and it's very nice to have one less machine. Having the versatility of the different wavelengths, and that is to do the YAG procedures versus the SLT, is very convenient, having one machine that has the capability of doing all those things. Even though I'm a general ophthalmologist, I see a lot of glaucoma patients, and I found that before buying the laser, I was having to refer a lot of those patients out of the practice. And I certainly still refer difficult glaucoma problems or people who don't respond and so on. But this way I'm able to keep many of those patients in the practice, treat them myself, and give them the best care possible without having to send them to a specialist.
Well, I think besides the fact that this is an excellent product, you know, the magnification, the optics, everything is very good with the laser and it works well. It's a cost-saving device, space-saving. You know, we only need one unit instead of two. It eases the patient flow. You know, we can sit at the machine, and often if I do, 15 lasers or 20 lasers at a time, each patient, it doesn't matter if they're SLTs or YAG capsulotomies, they can come in whatever order, and nobody has to change or move. Our nurses are all in the same place. You know, it makes sense for various reasons.
You know, I think the best thing about it is it has a very small footprint in the office, and we can combine two laser technologies into one unit. And it's in a matter of about 5 seconds, you can, with a touch of a button, switch over from one laser to the other. So it's just a very convenient machine to have in the office. It's very safe. Second of all, it's very efficacious. And finally, the laser treatment time is very quick. Safety-wise, I've never had a complication with the laser. Theoretically, you could get increased intraocular pressure for a short period of time after the treatment. But it's a very safe laser in my hands. As far as efficacy, it works well. We did an internal study about 5 years ago which showed, and we presented this at one of the big meetings, that we get on average about 5 points of lowering pressure after 2 months of treatment. And that's in all comers, even patients that have been on prostaglandin analogs, which usually have a little bit less response. So it works very well. And thirdly, it's a quick treatment. It takes about 3 to 5 minutes to do the treatment, so patients don't, it's a very quick procedure for them, and they like that.
The first one would be the size of the unit and its convenience with its sizing. The second would be the ability to adjust the unit with convenient control features. And the third would be the ease in which you can switch between the different treatment modalities. Perhaps the biggest benefit to having the Trio is having 3 treatment modalities all in one unit. It's quite convenient and simple to change between the 3 options.
Well, the obvious benefit is that it's an all-in-one machine. So from that standpoint, everything that I need is pretty much within an arm's length away. So to switch, for example, between a argon laser to a YAG laser while doing an iridotomy takes only about a couple seconds, and I don't even have to inconvenience the patient, asking them to move from one chair to another or one room to another. The other benefit that I noticed is that it's got a small footplate. So because of that, there's a lot more efficiency in bringing patients both in and out of the rooms. There's more real estate for our clinic to have other equipment as well. Because nowadays, we're looking at how to run a practice efficiently have the most amount of diagnostic and therapeutic tools and equipment to our control, but also make things run efficiently. So having a small footprint basically allows us to allow more space for whether it be aesthetics versus functional areas, and then we've been able to add more equipment as we need to, and then allow for more therapeutic and diagnostic imaging tests.
The thing I like most about having the Trio is that it's all in one unit, and so I have the capability to do SLT lasers, YAGs, as well as argon lasers all in one piece of equipment, and it has a very small footprint, and that's nice at my ASC where we don't have a lot of room. The thing I value the most from Luminous is a functional product, and you know, we actually had some other lasers in our surgery center that didn't work. They were non-functional, and so the great thing about Luminous is if you buy a Luminous laser, it works. It does what it's supposed to do. The repeatability of the SLT was an important factor in us deciding to purchase the laser. I have a ophthalmology-specific ambulatory surgery center. We have 6 ophthalmologists, and we debated the merits of SLT versus some of the other laser therapies that were out there. The data on the repeatability definitely allowed us to help make the decision to purchase the SLT. The SLT laser to doing the ALT procedure, I find that it's much easier to tolerate for the patients, as well as it's an easier, technically easier procedure to perform as a physician.